Consider that statistically speaking, the one who is close to you was likely to have experienced mental illness at some point in their lifetime. The World Health Organization (WHO) estimates that 1 in 4 people are affected by mental disorder at some point in their life. Those of us here today know mental illness has no prejudice. They have a 40 to 60% greater chance of dying prematurely than the general population. Each person is born with very individual qualities and potential. We, as a society, owe it to them to create a truly supportive environment in which they too can grow and move forward. But are we? Today, we have a chance to make history with Star Confex. We have seen the increase of attention to our world's broken mental health system over the past few years. But we have seen the very little action. Today, our message is very clear. It is time for the world to act for the mental health. We believe in no health without mental health. Let us introduce you with our action plan MH2030, our new landing, where our last goal to achieve is where mental health is valued, promoted, and protected, and able to obtain the highest healthy lifestyle to move forward with the modernization century for a betterment future. Why is it MH2030, our new landing? You will find out why. This plan is detailed based on 5 guiding principles as follows. Uphold human rights. Second, universal health coverage. Third, life cost approach. Fourth, evidence-based practice. And the last thing, multi-sectoral approach cooperation. These 5 guiding principles will be implemented to 3 departments: technology, administration, and health. Let's start with our first department, which that is technology. The main thing that has been evolving since way back to prehistoric times has always been technology. We have been developing our knowledge, cultivating power that is technology to help us humans to survive and improve our quality of life in this world. Mental health has become a big issue in this era, and thus we need to shift some of our resources in technology to solve this issue. The way to effectively cultivate our technology to solve this problem is by improving our research capacity and academic collaboration on national priorities for research in mental health. By 2030, all countries will be routinely collecting and reporting at least a core set of mental health and crit system for gathering data and information needed for evidence-based policy making and policy evaluation. It will be wise for us to invest in developing and maximizing the use of deep analytics with big data, artificial intelligence AI, Internet of Things, IoT, blockchain in making informed results that are efficient. The miracle of big data and AI technology is not being fully utilized in the most countries of the world. We are going to integrate the mental health into the routine health information system and identify, collate, routinely report, and use core mental health. The government also has to practice the data sharing policy or openly or open data for the purpose of research and innovation. Moving on to the second department, administration, which needs to take the most action to combat this issue. There are already many countries that have policies that are older than 10 years and they have not been reflected recently in the developments of international human rights standards and evidence-based practice. Because of this weakness, it results in a failure in the governance management of mental health problems. Our objective is to strengthen effective leadership and governance for mental health. All countries will have to develop their policy for mental health in line with international and regional human rights instruments by 2030. The national stage needs to prepare a mental health white paper to develop, strengthen, keep up to date, and implement the national policies to mental health within all sectors in line with all regional human rights instruments. We have to establish an environment that allow multi-stakeholder to engage in continuous discussion on mental health policy. Most important is to expand policy-raised mental health literacy in our society. Move on to the final department that is health system. The current world health system are still weak because their essence, which is catering towards the most important and the most malleable issue in health, which is mental health. What I mean by malleable is that it is the easiest issue that can be influenced and changed. The main issue of the current world health system are lack of availability of basic medicine and qualified health workers. We can prepare ourselves to solve this mental health problem when the country is in state of emergency. Our objective is to fully transform the health sector for better. By 2030, service coverage for severe mental disorder will have increased. Drastic measures that need to be taken are systematically shifting care away from long-stay mental hospital towards non-specialized health, reminding the system for hospitalization for medical care and protection while improving support for people with mental disorder, their family, and other people most infected. We also introduce mental health worker into undergraduate and graduate curricula. Learning for the recent pandemic, we have to cooperate with the emergency administration to include mental health and psychosocial supports need in emergency preparedness. In a nutshell, what I wanted to convey in my speech was we have the power to make a difference. We know what it means to have our life or the life of people we love get off track because of mental illness. It is all of humankind's responsibility. We know mental illness can be treatable when they have access to appropriate and comprehensive care. Look, I want you to start it right now while we are here. Put your name, phone number there, and let's start this paperwork. I believe in the end, if we unite and work together, it can be done successfully. Believe in me.